vision of Hospice of Cincinnati is to provide leadership for the entire region to embrace the value of end-of-life care and planning. That's a big part of our vision, and we're really excited to have received a grant from Bethesda Inc. to work on a big project to improve end-of-life care in our community. And we're working on advanced directives. It's called Transforming Conversations, Conversations of a Lifetime. We've got a great website. There are a lot of other components to it, but it is really empowering to have the opportunity to be involved in a project like that I think will make a big difference in people's lives.
My physician colleagues are some of the most respected in the country, and they teach, they do research, they lecture nationally and internationally, and so it's a very exciting environment to work in and to know that we have any resource that would be required to help care for our patients.
I subscribe to the truism that people don't care what you know until they know that you care. I think life is about relationships, period. And as a leader, the onus is on us to reach out, to learn the stories of those around us, to make a point every day to tell people what a great job they're doing and how meaningful their work is for you. And I think that when people understand that you are looking out for their best interest, they're willing to give you their best.
I was a pioneer in the field of implant dentistry, and I had some mentors who I learned from and kept giving me encouragement to continue to go on and continue to learn and continue to develop. And if this was my passion, don't stop. And they were a very good example for me to keep going.
A former boss of mine said he was an archer, and he always said, be an arrow. And I thought about that, I've internalized it. A lot of people are shotguns, and they take the blast approach. And they hit a scatter, and they hope they hit the target. Sometimes they do, sometimes they don't.
The number one advice is be a servant. Someone said to me, just show up is the beginning of all accomplishments.
One of the best pieces of advice I received early on when I was beginning to have more and more responsibility in leading teams is that teams succeed far more often than individuals do. And that the leader of the team's job was to promote a respect for everyone on the team because they all contributed.
Well, we've introduced every major advance in cardiovascular medicine over the past 30 years to our region. We've accomplished 3 first in man, at least 9 first time in the United States. Application of leading-edge, groundbreaking medical technologies. Through leadership roles in large-scale clinical trials of new drugs and devices, we have actively helped to shape the course of cardiovascular medicine in the United States and worldwide.
I think some of the best advice I ever got was to keep the main thing the main thing. And what that means to me is just to really stay focused on what the priorities are and try not to get distracted by too many of the other little things that go on, and to really, again, stay focused and stay concentrated on what's most important.
The Cincinnati Eye Institute is doing the best that we can to care for our patients. We also are providing care for those that cannot afford it. We've started the Roselawn Eye Clinic for charity care for people who do not have insurance and cannot afford to buy glasses. And so patients can come in there and there's no charge, and they're given a certificate so they can go out and get glasses so they can get a job.
The goal of our organization is to increase communication amongst Children's Hospital and community physicians. In healthcare, when you improve communication, I think you're improving general care of the child overall, and general care improvements will lead to better outcomes medically throughout the city, hopefully.
Making a difference, and well, that's what I said before. What we do is we give patients back their smile, and The other thing that I've been involved in is developing techniques and devices that I've taught other dentists around the world. And I developed one device that makes it easier for them to treat patients and to give them back a better quality of life.
So from a sustainability perspective, we've implemented programs that have grown and been implemented throughout the region. The very first one that I did when I first started here about 5 years ago was the elimination of a chemical in our NICU, our neonatal intensive care unit, called DEHP. This is a chemical that is in a lot of medical supplies, and UC Health was one of the first ones in the country to eliminate that chemical, which really helps the development and the growth of our babies, our most vulnerable population.
On the healthcare team, we dominantly represent healthcare providers. And it's a very powerful, motivating tool for those lawyers and professionals to know that they are not only doing top quality work, but that the results of their work help those providers render healthcare services to the population.
Superpower. I would want to bring collective calm to every situation.